6 months ago, Louisa and her family received news that would change their lives.
She was talking about red and white blood corpuscles, and suddenly she said leukemia.
Louisa was diagnosed with leukemia, and a few days later, on her 8th birthday, she received her first chemotherapy.
But Louisa still feels nauseous.
Suddenly, school and playmates were replaced by hospital or doctors, and today drugs and disease overwhelm everything else.
Last week she had a mouth infection, so we had to come off morphine. She did so over a weekend, and now we are on methadone. Of course it's very invasive, but we tell ourselves it mustn't take over completely. At any rate, we agree that it's the doctors and nurses who look after the disease, and I have taken leave from work. It's my job to look after the good side.
As little as 30 years ago, few children survived cancer. But the biggest paediatric oncology department in Scandinavia is now so skilled that it can cure over 80%, a result which is very much due to a unique international partnership and which has also gained the department the Global Excellence in Health Prize. If your child is affected by a disease so serious that you may lose him or her, should you go somewhere else to obtain the best possible treatment? No. The results we achieve in Copenhagen or in Kiel or in London or in Tromsø are equally good because we have similar treatment strategies. In every case, the Children's Cancer Department records the progress of the disease and the treatment pathway down to the tiniest detail in huge international registers. This system ensures that research results are disseminated and shared more rapidly while ensuring high international treatment standards. I don't think it's unrealistic that in 10 years' time the cure rate will have moved from 80 to 90%. But it's no longer just about curing the children. Today, research is also being done into how to prepare children for life after their disease. Over the last 20 years, the focus has moved from just curing children of their cancer to making them normal. And I say normal because when a child of 4, 5 or 6 gets cancer, his or her personality isn't finished, it's still being moulded. But so much happens to us in the interaction with classmates and playmates after school and when we do sports. If a child gets cancer, we remove them from normal everyday life. For Louisa, it was also the prospect of having to give up friends and school that concerned her most of all.
Yes, she had cancer, but what mattered most was, I miss my class at school. Of course it was. It was her life that just crumbled.
The Rigshospitalet Paediatric Oncology Department has set up an ambassador scheme. 2 classmates are appointed to follow and support their fellow student throughout the process. Classmates experience what it means to the patient to have this serious disease. They understand the process, and the child doesn't feel punished twice. Twice because he or she has cancer and senses that mum and dad are unhappy, and because he or she loses contact with a social life that means so much.
It was the best medicine Louisa had been giving the whole time we've been in the hospital, being visited by a child from her class. It was so fantastic. It was a great day. We could tell how much she progressed in just that day.
Louisa still has 2 years of therapy left, but the good prospects of a cure and her close contacts with friends make the whole situation easier.